Hello, my name is Dr. Alan Franklin with Victory Hearing and Balance Center here in Austin, Texas. We're shooting this quick video today to talk a little bit about how to insert the various styles of hearing aids. Let's start with the largest size custom in-the-ear device. This device is what we refer to as a custom in-the-ear or full shell device. As you can see, it fits in my ear and fills up the entire concha bowl. Now this device, the best way to start with inserting this device is by holding the hearing aid itself between your thumb and index finger respectively, with the in-the-ear, the receiver portion going down into your ear or facing in towards the center of your head, and the outer portion with the battery door and the volume control, if you have one, facing away from your head. You start, index finger and thumb holding the hearing aid. You place the device directly into your ear, wiggle at the bottom, wiggle at the top, and it should sit flush in the ear canal just like that. Some designs will require a little bit of a twist back to help them slide in the ear. Now, to get this style of hearing aid out of the ear, I'd like you to use your thumb or index finger and pry that device up and out. That's the appropriate way to remove this style of hearing aid. On to the next smallest size of custom in-the-ear device is a half shell or canal size. Much like the in-the-ear device, we're going to hold between your thumb and index finger, just like so. Place that into the hearing aid, into the ear canal, just like so. Slides right in. Sometimes they require what I consider a one-finger wiggle. You're going to take your index finger and wiggle that around to make sure it's seated just right in the ear canal. To remove this style of device, much like the full shell device, we're going to take your thumb or index finger and pry that out of the ear as well. The smallest size of custom in-the-ear device is a CIC-sized hearing aid. These, you hold just the removal filament or small removal handle. You're going to pinch between your thumb and your index finger and straight that right into the ear canal. Now, it's important with this size, of course, the removal handle is on the faceplate, so that's going to point away from your head. The receiver side is going to point in towards the center of your head. The writing on the hearing aid typically faces directly away from the user, so you should not see the writing on the hearing aid when inserting this size device into the ear canal. Drops right in. Sometimes, once again, requires a little bit of a wiggle. Alright, to remove this size of device, that's what the removal handle is for. We're going to pinch and pull straight out. Onto a behind-the-ear style hearing aid. Now, behind-the-ear style hearing aids, this is a larger behind-the-ear style hearing aid. It's a two-piece system with the hearing aid sitting behind the ear and the custom molded earpiece sitting in the ear itself. What I typically recommend in this case is that the user hang the hearing aid over the ear initially, and then we're going to just drop the earpiece itself into the ear canal like so. Or a second method used to get behind the ear hearing aids in is this. I would recommend that you hold, this method is somewhat more complicated, would have you hold the earpiece between your thumb and your index finger, much like the in-the-ear hearing aid. The hearing aid itself sits over the top of my index finger. We're going to insert the ear mold first, just like a full shell hearing aid, and second, flip the hearing aid itself over the ear. Let me show that to you again. Ear mold first, just like so. Hearing aid, flip it over second. Now, to remove this style of hearing aid, ideally, just like the full shell device, you're going to take your thumb and pry the earpiece out. The hearing aid will follow. We'd like you not to typically grab the tube itself. The tube is not adhered into the ear mold very often with the permanent adhesive, so it's easy to separate the two. So I'd suggest that you take the earpiece itself out with your thumb, pry it out, your thumb and index finger, and avoid using the tube to remove that style of hearing aid. The last style we're going to discuss in this video is the micro or mini behind-the-ear hearing aids. Now, sometimes these use custom earpieces, sometimes they use non-custom earpieces. I typically do, though, recommend you hang that device over the ear first, and second, work the earpiece itself down into the ear. Now this style device, Austin, has a lock on it like so. That lock sits at the bottom of the ear. It goes down and back, and it serves the purpose for retention to hold everything in place. So once again, first, let's have you hang that over the top of the ear. Second, work the earpiece in. Third, if you have the lock, slide the lock in place at the bottom, which holds everything in place nice and neat. I hope that answered some questions for you. I know it's frustrating to learn inserting hearing aids, but it takes a little bit of practice, though, and a little bit of patience. Dr. Alan Franklin signing off, Victory Hearing and Balance Center, 512-443-3500. Thanks and have a great day.